Hello to everyone. So now in this video we'll be discussing on the topic of atrial fibrillation. So this is one of the pathology of our heart. Okay, so atrial fibrillation is a supraventricular tachyarrhythmia, you can say. Okay, and violation of heart's rhythm and frequency of its contraction originating from the structure localized above ventricles. Okay, so the meaning is that in atrial fibrillation the heart actually beats at very fast rate, and again it comes to very slow rate, so that is called as arrhythmia. So the heart rate actually fluctuates. Okay, and supraventricular meaning above the ventricle, so the pathology is above the ventricle, so that is why it is a supraventricular tachyarrhythmia. So worldwide most common cardiac arrhythmia in adult is AF, that is atrial fibrillation. Now what is the physiology of heart? So in the heart we know that we have four chambers, two atria and two ventricles, and right atrium we have sinus nodes from where the impulse is generated, and impulse from the sodium potassium channel opens and impulse is generated in the sinus node, then goes to the AV node to Purkinje fibers, Purkinje fiber to, that is bundle of hairs to Purkinje fibers, and the your atria and ventricles simultaneously contracts. Okay, so signal passes through atria, initiate contraction of the heart. So sinus node is the main center for the initiation of the contraction of heart. So this is a basic physiology of heart regarding the heartbeat or the rhythm of the heart. Okay, so normal heart, how it works. Now, how common is atrial fibrillation and whom it is most common? So 2 to the 4% of adults and number of patients with condition is expected to increase due to the life expectancy. So 2 to 4% of patients occurs with AF. Lower in women. So this case is lower in women as compared to men. So what is the manifestation clinical features we see actually in disease? Atrial fibrillation is a very rapid heart rate, irregular activation of atria more than 300 beats per minute. So you know that the normal heartbeat is 72 beats per minute, but in the case of atrial fibrillation it can go up to 300 beats per minute in the severe cases. If the patient is an untreated patient, so the heartbeat actually rise between 120 to 160. So it actually fluctuates. So it can be 150, again comes to 160, then again drops down to 120. So that is actually called as arrhythmia. Now what is the decrease risk factors here? So AF is most common persistent arrhythmia. More than 94% of patients are above 60 years of age in which it occurs, and prevalence above 80 is 10%. So above 80, the patients who are above 80, they have very less risk of developing atrial fibrillation. Now what are the risk factors? So patient with hypertension, that is arterial hypertension, diabetes, heart disease, and sleep apnea. Okay, so these are the patients who are more prone to the atrial fibrillation. Now, atrial fibrillation somewhat develops as a result of trigger of such as hyperthyroidism, also increase in thyroid function, acute alcohol intoxication, another medical emergency, that is MI or pulmonary embolism. So these are also one of the main risk factors for developing atrial fibrillation. And atrial fibrillation occur in 30% undergoing heart surgery. So for patients who are gone through heart surgery of any heart transplant or any coil stenting for the like the patient with angina, so they have gone through any heart surgery, so they are at high risk, that is 30% have gone undergoing with atrial fibrillations. And what are the predisposing pathologies include like ischemic heart disease, acute cardiovascular disease, congenital and acquired heart defects, any congenital heart birth defect, hypertension, lung disease, any use of stimulants like caffeine, alcohol, any type of drugs which actually stimulates your brain or your heart. So those are the drugs which can also be the predisposing or risk factors. What are the types of atrial fibrillation? We have paroxysmal, in which episodes start and spot spontaneously. It started and again it stopped, that is called as paroxysmal. Persistent, it persists for longer duration and access more than 7 days, so it lasts about 7 days, then we called it as persistent AF. Constant means heart rhythm does not return to normal, then that patient is called, it is as a type of atrial fibrillation is called a constant atrial fibrillation. Now what is the atrial fibrillation pathogenesis? Pathophysiology of atrial fibrillation is based on the idea of one of the more electrical foci, means the foci which is other than sinus node. As I told you, in a normal physiology we have the sinus node where the contraction or impulse is generated, but in atrial fibrillation this electrical foci actually changes from sinus node to different area in the heart, and because of that there is irregular heartbeat and irregular contractions of atria and the ventricles. So okay, and rapidly discharging lesions are thought to initiate irregular activity, as I told you, and pulmonary veins are the most common central role in atrial fibrillation through automatic mechanism. So these are the most common area where the foci are present, and cardiomyocytes in the pulmonary veins developed as a pacemaker like activity. Okay, And parasympathetic overactivation can also cause parasympathetic overactivation. Pathological condition like CHS and mitral valve disease can also lead to the atrial pathogenesis. Now what is, you can see this normal, as I told you, this is the impulse internodal pathways. This is a normal ECG. I will show you the normal physiology. This is a SA node, you can see it here. Impulse goes to the AV node. This is a right atrium, below is the ventricles too. Okay, and that is why it is called as supraventricular, because the lesion actually is located above this. And this is AV node, sinus node, impulse goes to AV node to bundle branch, as I told you, then goes to the Purkinje fibers left and right. Okay, so this is a normal physiology, how the impulse is conducted. Okay, if this impulse is somewhat lying in different area, this is a sinus node, which is the first pacemaker, and if it lies here somewhat, then you can see it here. Okay, so you can see erratic impulse are generated here. So here, this is left atrium, but these are the impulse which are leading to the cause of, you can, in this diagram you can see this is a normal heart rhythm. Okay, and this is the atrial fibrillation, irregular impulses generating from here, then going to there, this area, then this. Because of that, there is irregular contraction. This is the ECG, you can see it here, atrial fibrillation. Okay, very irregular heart rate. This is a normal ECG. So there's a patient who are with atrial fibrillation develops like this. Now, how does AF progress? More than 1 year, structural changes occurs in atrium, which contribute to re-entry and automatism of heart, and different to maintain the sinus rhythm. So above 1 year, there is very less chance to develop to the normal stage, because there is a structural changes in atrium occurs. Because of that, there is no sinus rhythm possible as in the normal case. Now, paroxysmal FF progress to the persistent over many years. So paroxysmal, as I told you, starts and stops, but if it goes to the persistent, then it goes above many years. Okay, and the structural changes in atrial hypertrophy occurs in response to hypertension. So atrial actually compensate increase in size, that's called atrial hypertrophy. Increase in heart rate due to atrial fibrillation can cause circulatory problems or exacerbate heart failure. So risk of heart failure increases. Progression of atrial remodeling leads to even greater shortening of refractory period. Increase in duration of irregular activity provokes persistent AF. So from paroxysmal, if there is any atrial remodeling, leads to even shortening refractory period, that can lead to your persistent type of atrial fibrillation. So atrial fibrillation increases risk of heart failure. It also increases risk of stroke by 5 times. So this is the atrial fibrillation, as I told you, in the simple way. Thank you.